Welcome to our video series, Conceptual Relationships of Words in the English Language. In this series, we present English vocabulary in a structured and hierarchical manner. Each video showcases a range of terms and their corresponding definitions, presented in an organized sequence from broader concepts to more specific details. The series is divided into playlists, videos, and sections, each delving into distinct aspects of the English language. To get the most out of these videos, here are some of the suggested uses. We will be using WordNet as our primary reference throughout the series. For detailed information about WordNet, please visit the official WordNet website. If you're new to our channel, we recommend starting with our introductory videos. They provide essential context for understanding our approach, purpose, and methodology. For simpler navigation, we presented an outline of the terms and relationships in one of these introductory videos. Remember to show your support by liking, commenting, sharing, and subscribing to our channel. In this episode, we will explore abnormality. This video is part of the playlist Attribute State. Attribute State playlist is one of two playlists devoted to the conceptual domain attribute. Attributes are linguistic elements that serve as modifiers to provide descriptive information about another word. They convey qualities, characteristics, or properties associated with the entities they modify, enriching the meaning and context of the expression. Section 1. In this section, we will explore abnormality in development.
Condition. Condition.
A state at a particular time.
The current status of the arms negotiations.
Physical condition. Physical condition.
The condition or state of the body or bodily functions.
Abnormality. Abnormality.
An abnormal physical condition resulting from defective genes or developmental deficiencies.
Arrested development. Arrested development.
An abnormal state in which development has stopped prematurely.
Cryptorchidity. Cryptorchidity.
Failure of one or both teeth to move into the scrotum as the male fetus develops.
Monarchism. Monarchism.
Failure of one teeth to descend into the scrotum.
Cyclopia. Cyclopia.
A developmental abnormality in which there is only one eye.
Dysplasia. Dysplasia.
Abnormal development of organs or cells, or an abnormal structure resulting from such growth.
Anaplasia. Anaplasia.
Loss of structural differentiation within a cell or group of cells, often with increased capacity for multiplication, as in a malignant tumor.
Aplasia. Aplasia.
Failure of some tissue or organ to develop.
Fibrous dysplasia of bone. Fibrous dysplasia of bone.
A disturbance in which bone that is undergoing lysis is replaced by an abnormal proliferation of fibrous tissue, resulting in bone lesions or skin lesions.
Albright's disease. Albright's disease.
Fibrous dysplasia of bone affecting multiple bones.
Monostotic fibrous dysplasia. Monostotic fibrous dysplasia.
Fibrous dysplasia of bone confined to a single bone.
Hyperplasia. Hyperplasia.
Abnormal increase in number of cells.
Benign prostatic hyperplasia. Benign prostatic hyperplasia.
Enlarged prostate appears to be part of the natural aging process.
Hypertrophy. Hypertrophy.
Abnormal enlargement of a body part or organ.
Acromegaly. Acromegaly.
Enlargement of bones of hands and feet and face, often accompanied by headache and muscle pain and emotional disturbances, caused by overproduction of growth hormone by the anterior pituitary gland due to a tumor.
Adenomegaly. Adenomegaly.
Gland enlargement.
Cor pulmonale. Cor pulmonale.
Enlargement of the right ventricle of the heart due to disease of the lungs or of the pulmonary blood vessels.
Dactylomegaly. Dactylomegaly.
Abnormally large fingers or toes.
Elephantiasis. Elephantiasis.
Hypertrophy of certain body parts, usually legs and scrotum, the end state of the disease filariasis.
Elephantiasis neuromatosa. Elephantiasis neuromatosa.
Hypertrophy of a limb.
Elephantiasis scroti. Elephantiasis scroti.
Swelling of the scrotum resulting from chronic lymphatic obstruction.
Nevoid elephantiasis. Nevoid elephantiasis.
Thickening of the skin, usually unilateral on an extremity, caused by congenital enlargement of lymph vessel and lymph vessel obstruction.
Giantism. Giantism.
Excessive size, usually caused by excessive secretion of growth hormone from the pituitary gland.
Splenomegaly. Splenomegaly.
An abnormal enlargement of the spleen.
Hypoplasia. Hypoplasia.
Underdevelopment of an organ because of a decrease in the number of cells.
Fetal distress. Fetal distress.
An abnormal condition of a fetus, usually discovered during pregnancy and characterized by an abnormal heart rhythm.
Gynecomastia. Gynecomastia.
Excessive development of the breasts in males, usually the result of hormonal imbalance or treatment with certain drugs, including some antihypertensives.
Hydatid mole. Hydatid mole.
An abnormality during pregnancy, chorionic villi around the fetus degenerate and form clusters of fluid-filled sacs, usually associated with the death of the fetus.
Hydramnios. Hydramnios.
An abnormality of pregnancy, accumulation of excess amniotic fluid. Section 2. In this section, we will explore structural abnormalities.
Acromphalus. Acromphalus.
Abnormal protrusion of the navel, sometimes the start of umbilical hernia.
Asynclitism. Asynclitism.
The presentation during labor of the head of the fetus at an abnormal angle.
Atresia. Atresia.
An abnormal condition in which a normal opening or tube in the body, as the urethra, is closed or absent.
Deviated septum. Deviated septum.
Abnormal displacement of any wall that separates two chambers, usually in the nasal cavity.
Deviated nasal septum. Deviated nasal septum.
Abnormal shift in location of the nasal septum, a common condition causing obstruction of the nasal passages and difficulty in breathing and recurrent nosebleeds.
Dextrocardia. Dextrocardia.
Abnormal condition where the heart is located toward the right side of the chest.
Hypospadias. Hypospadias.
An abnormal condition in males in which the urethra opens on the undersurface of the penis.
Inversion. Inversion.
Abnormal condition in which an organ is turned inward or inside out, as when the upper part of the uterus is pulled into the cervical canal after childbirth.
Lagophthalmos. Lagophthalmos.
Abnormal condition in which an eye cannot close completely.
Pachycelia. Pachycelia.
An abnormal thickness of the lips.
Palmature. Palmature.
An abnormality in which the fingers are webbed.
Phimosis. Phimosis.
An abnormal tightness of the foreskin preventing retraction over the glands.
Retroversion. Retroversion.
A turning or tilting backward of an organ or body part.
Retroversion of the uterus.
Spinal curvature. Spinal curvature.
An abnormal curvature of the vertebral column.
Dowager's hump. Dowager's hump.
Abnormal spinal curvature that results when osteoporosis causes the spine to collapse, seen most often in elderly women.
Kyphosis. Kyphosis.
An abnormal backward curve to the vertebral column.
Lordosis. Lordosis.
An abnormal inward, forward curvature of the vertebral column.
Scoliosis. Scoliosis.
An abnormal lateral curve to the vertebral column.
Strabismus. Strabismus.
Abnormal alignment of one or both eyes.
Cross-eye. Cross-eye.
Strabismus in which one or both eyes turn inward toward the nose.
Walleye. Walleye.
Strabismus in which one or both eyes are directed outward.
Torticollis. Torticollis.
An unnatural condition in which the head leans to one side because the neck muscles on that side are contracted.
Transposition. Transposition.
Any abnormal position of the organs of the body. Section 3. In this section, we will explore functional abnormalities.
Aneuploidy. Aneuploidy.
An abnormality involving a chromosome number that is not an exact multiple of the haploid number. One chromosome set is incomplete.
Erethism. Erethism.
An abnormally high degree of irritability or sensitivity to stimulation of an organ or body part.
Hydrocephalus. Hydrocephalus.
An abnormal condition in which cerebrospinal fluid collects in the ventricles of the brain. In infants, it can cause abnormally rapid growth of the head and bulging fontanelles and a small face. In adults, the symptoms are primarily neurological.
Hypervitaminosis. Hypervitaminosis.
An abnormal condition resulting from taking vitamins excessively, can be serious for vitamins A or D or K.
Infantilism. Infantilism.
An abnormal condition in which an older child or adult retains infantile characteristics.
Adolescence. Adolescence.
A form of infantilism characterized by physical underdevelopment but normal intelligence.
Irritation. Irritation.
Pathology, abnormal sensitivity to stimulation.
Any food-produced irritation of the stomach.
Mental abnormality. Mental abnormality.
Any abnormality of mental function.
Organic brain syndrome. Organic brain syndrome.
Mental abnormality resulting from disturbance of the structure or function of the brain.
Pneumothorax. Pneumothorax.
Abnormal presence of air in the pleural cavity resulting in the collapse of the lung, may be spontaneous, due to injury to the chest, or induced, as a treatment for tuberculosis.
Progeria. Progeria.
A rare abnormality marked by premature aging, gray hair and wrinkled skin and stooped posture, in a child.
Sequela. Sequela.
Any abnormality following or resulting from a disease or injury or treatment.
Paralysis is one of the sequelae of poliomyelitis.
Subnormality. Subnormality.
The state of being less than normal, especially with respect to intelligence. Section 4. In this section, we will explore abnormalities caused by the absence of something, and by a change in size.
Abrachia. Abrachia.
The condition of having no arms.
Acardia. Acardia.
Congenital absence of the heart, as in the development of some monsters.
Acephalia. Acephalia.
Absence of the head, as in the development of some monsters.
Acoria. Acoria.
Absence of the pupil in an eye.
Amastia. Amastia.
Absence of the mammary glands, either through surgery or developmental defect.
Anorchism. Anorchism.
Absence of one of both teeth.
Ectrodactyly. Ectrodactyly.
Congenital abnormality involving the absence of some fingers or toes.
Acromicria. Acromicria.
Abnormally small extremities, underdeveloped fingers and toes.
Brachydactyly. Brachydactyly.
Abnormal shortness of fingers and toes.
Hepatomegaly. Hepatomegaly.
Abnormal enlargement of the liver.
Microencephaly. Microencephaly.
An abnormally large brain case.
Macrocephaly. Macrocephaly.
An abnormally large head, differs from hydrocephalus because there is no increased intracranial pressure, and the overgrowth is symmetrical.
Microbrachia. Microbrachia.
Abnormally small arms.
Microcephaly. Microcephaly.
An abnormally small head and underdeveloped brain.
Nanophthalmos. Nanophthalmos.
Condition in which both eyes are abnormally small but otherwise normal.
Varix. Varix.
Abnormally enlarged or twisted blood vessel or lymphatic vessel.
Varicosity. Varicosity.
Varix or varicose condition in which a vein is swollen and tortuous.
Varicose vein. Varicose vein.
A vein that is permanently dilated, most common in the legs. Section 5. In this section, we will explore aberrance, or a state or condition markedly different from the norm.
Aberrance. Aberrance.
A state or condition markedly different from the norm.
Chromosomal aberration. Chromosomal aberration.
Any change in the normal structure or number of chromosomes often results in physical or mental abnormalities.
Monosomy. Monosomy.
Chromosomal abnormality consisting of the absence of one chromosome from the normal diploid number.
Sex-linked disorder. Sex-linked disorder.
Any disease or abnormality that is determined by the sex hormones.
Hemophilia is determined by a gene defect on an X chromosome.
Hemophilia. Hemophilia.
Congenital tendency to uncontrolled bleeding usually affects males and is transmitted from mother to son.
Hemophilia A. Hemophilia A.
Hemophilia caused by a congenital deficiency of factor V occurs almost exclusively in men.
Hemophilia B. Hemophilia B.
A clotting disorder similar to hemophilia A, but caused by a congenital deficiency of factor X.
Von Willebrand's disease. Von Willebrand's disease.
A form of hemophilia discovered by Erich von Willebrand, a genetic disorder that is inherited as an autosomal recessive trait, characterized by a deficiency of the coagulation factor and by mucosal bleeding.
Turner's syndrome. Turner's syndrome.
A chromosomal disorder in females who have only one X chromosome, marked by dwarfism and heart abnormalities and underdeveloped sex organs.
Trisomy. Trisomy.
Chromosomal abnormality in which there is one more than the normal number of chromosomes in a cell.
Mongolism. Mongolism.
A congenital disorder caused by having an extra 21st chromosome, results in a flat face and short stature and mental retardation.
Deflection. Deflection.
A twist or aberration, especially a perverse or abnormal way of judging or acting.
Atypicality. Atypicality.
Any state that is not typical. Section 6. In this section, we will explore anomaly, or a deviation from the normal or common order.
Anomaly. Anomaly.
Deviation from the normal or common order or form or rule.
Birth defect. Birth defect.
A defect that is present at birth. End of episode. Thank you for watching. If you enjoyed this video, don't forget to like, comment, share, and subscribe to our channel for more engaging content. In the next episode, we will present attribution.